Good evening, everyone. We would like to welcome you to this Ask Me Anything for Dry Eye Disease. Thank you all so much for joining us from different parts of the world. We decided to organize this Ask Me Anything today on the occasion of World Sight Day. And we also noticed that a lot of questions tend to go unanswered. So we hope that this session will be beneficial, not just to those who are present here, but also to everyone in the community. We got a great response from the community and received quite the flood of questions. So we'll do our best to answer all the questions we can, given the time constraint of 1 hour. If any of you did not have the chance to submit your questions, please feel free to submit them in the chat box. And if we're unable to answer your questions during the session, we will mail you the answers after consulting with our doctors later. Before we start, I request everyone to please keep your mics muted. And if you have any questions or require any assistance, please let us know in the chat box. To kick things off, let me introduce our doctor today. We are honored to have with us Dr. Mathew Kurian, a highly experienced high-volume cataract and refractive lens surgeon with expertise in IOLs. He brings with him more than 2 decades of experience and currently serves as a superintendent at Chaitanya Eye Institute, Kochi. Dr. Mathew, if you would like to start.
So, thank you, Anushka, and thank you, Team Autoyos, for this opportunity. Today is a very opportune time to do this kind of a presentation because, as you know, today is World Sight Day. I'd like to just share my screen. So World Sight Day is organized by the International Agency for the Prevention of Blindness. And this year's theme is Love Your Eyes at Work. And it is very opportune that we get this chance because dry eye disease is something that is very common among workplace problems in the community today. So this year's campaign focuses attention on the importance of eye care, which has been for the last several years as well. And it's a reminder to people to prioritize their eye health. And the IABP has challenged that about 10 million people globally should pledge their eyes, to have their sight checked before World Sight Day this year. So they're at about 7 million pledges completed, and hopefully by the end of the day, we'll reach the target. The focus this year is workplaces to encourage the employees to have the vision check. And it is well established and documented that clear, healthy vision improves productivity. It prevents workplace injury and improves employee well-being. So what I'm going to talk from now on is that this is a presentation for general information, awareness creation, and educational purposes. This presentation is not intended as a substitute for medical advice, diagnosis, and treatment. And I'm not personally endorsing any of the products or services over here.
Thank you very much, Dr. Kurian. Yeah. So to kick things off, we'll start with questions that are based on the topic of digital eye strain. So for our first question, we have, what are the reasons for dry eyes apart from prolonged use of screens?
So if we look at the digital eye strain itself, we know that approximately 80% of individuals use screens for more than 2 hours a day. So use of a digital device for more than 2 hours a day is one of the risk factors. A consequence of extended digital viewing is that 2/3 of these people blink very much less frequently. And as a consequence, about 60 to 90% of individuals have symptoms. And these symptoms are eye strain, headaches, blurred vision, dry burning, irritated eyes, etc., etc. And the reason why this happens is that we don't consciously see it, but a digital image is composed of pixels. And as you can see, the edge of this varies in intensity, and the eye is always trying to, optimize the focus because some aspect of the image continues to remain blurred. Whereas the same thing in print would have a sharp distinction between what is white or black, and that eases the strain on the eye, and the fatigue is much less. So what can we do to reduce this? When you're using a digital screen, we need to even correct very small pass. Use anti-reflective coatings on the lens surface to reduce glare and indirect reflections from the screen. Tinted or photochromatic glasses may be useful. Individuals over the age of 40 need to use progressive lenses. Basically, the range that we use to see is from near 30 centimeters for mobile or book, maybe 80 to 90 centimeters for the desktop or laptop, and distance vision, which is more than 40 feet, 20 feet away. So now the computer screen is at an intermediate distance, and the progressive lens has a segment which will give you that intermediate distance good vision. A bifocal lens, the conventional bifocal or a single vision lens or a reading distance lens, will not have that segment. So people, you will notice, will tend to come closer, look up, tilt their head back to look through the bottom portion of the lenses, and that would cause neck pain, back pain over a period of time. The other things that we need to remember is very simple: set up, get up, and wet up. So setup is that our back should be straight, legs and thighs should be well supported, arms should be supported. The working distance rule for the digital devices: 1 foot for mobiles or tablets, 2 feet for desktop or laptop, 10 feet for televisions. We should be having the screen top just perpendicular or slightly below eye level, with a larger anti-glare matte finish screen, which will be comfortable for eyes, with the highest possible refresh rate and resolution, which will reduce the strain for the eyes, and there should be a larger font size if possible when there is strain. We need to remember to take a break every now and then, and the rule is 20-20-20. Take a break for 20 seconds every 20 minutes by looking at something 20 feet away. When we are concentrating on something on the screen, we tend to forget to blink. And so we need to remember to blink or use tear supplements for lubrication. So these could be in the form of drops, high viscosity drops, gels, special formulations, which include osmoprotectants, which are maintaining the osmolality of the tear film, and dietary supplementation in the form of certain omega-3 fatty acid capsules. We can also think of looking at digital well-being. Most tabs have these facilities. On the settings, if we go to the app timer, we can actually set how long you want to use it. You can have a schedule, and which days in the week you would want to shut down at what time. This would help to automate this process, because you tend to get lost as you are looking at the screen and forget the time passing. Okay, so you can have it at a fixed time so that bedtime is not disturbed, and you continue till a decent time in the morning when you would go to sleep, when you would wake up in the morning. Other things you can do is the blue light filter, which you can put on, and the dark mode, both of which it is desirable to put on an automatic format so that it comes on in the evening. Adaptive brightness, again, reduces the strain on the eye by automatically changing the brightness depending on the ambient lighting of the room. Blue light filter, in my case, it is sunset to sunrise, automatically turned on, and the opacity is the maximum that I can get. And my screen will go to this orangish light, and this helps to reduce the blue light from the digital device as we are winding down for the day and getting prepared to go to sleep. And this is supposed to help in the release of melatonin, which helps in your sleep cycle. For kids, certain rules we need to put. COVID times has seen more than 100% increase in screen time, and screen addiction is an illness, and it is strongly associated with the worsening of minus power and myopia in children. And there are countries where the prevalence of myopia is almost 9 out of 10 by the time they finish school. So for online classes, this was something that came out in the middle of COVID. Young children, no educational calls at all, 4 to 6 years, about an hour and a half, up to 12 years, maybe 2 hours of screen time, but with a lot of breaks. And children up to 16 years, as they're completing schooling, should not do more than 6 to 8 hours, but with adequate number of breaks. Parents need to educate themselves because a lot of content is available online, and they need to educate their children also how to use these things safely and be vigilant. Children should also be encouraged to go outdoors and practice games or any activity which involves one of the exposure to sunlight. Vitamin D has a role in preventing myopia progression, and distance vision activities also encourage the healthy, good distance vision and prevent myopia progression. So all these things put together, things that we can do to naturally reduce the eye strain and the possibility of myopia associated with these digital devices.
We've developed a preventive care tool that will remind our users to blink, and as whenever the blink rate falls below a certain threshold, it reminds you that you need to blink slowly and completely. So I prepared a demo video just to show you guys the kind of features that we have. Please do check it out. And if you have any feedback for us related to the app, we would love to hear about it as well. So, Dr. Mathew, shall I move on to the next question? So speaking, since you mentioned that children also need to be careful, typically by around what age do they find that they're also experiencing this issue of eye strain and dry eyes?
So dry eye disease, computer vision syndrome, digital eye strain, all these were actually profession-based issues till COVID happened. So typically IT professionals, BPO workers, etc., who had to spend hours on the system, people in the finance industry, banking sector, where most of the things were computerized, they were the people who initially presented. But with COVID, online classes starting, I think this has become a ubiquitous problem, because children as young as first class, second class kids, that's 5, 6 years old, were presenting with, some of them were presenting with discomfort and symptoms suggesting of dry eyes. And uh, their parents and grandparents who would not have spent so many hours on the digital screens while monitoring what the kids were doing were also unconsciously looking at the screen for such long periods of time. And so we found that even they came with dry eye syndrome. So the older age group is definitely more vulnerable because as you grow older, the tear quality comes down due to various reasons, which I shall discuss later. But post-COVID, increased digital screen use, this has resulted in this becoming a problem which starts at a very young age.
I see. And are Blu-ray glasses effective?
So one of the issues with digital devices is the amount of blue light in the light from the screen. And so blue cut glasses are recommended to reduce the strain. In countries like Japan, you have special filtered glasses which are yellow tinted so that it does not alter the sleep cycle also. And today, the companies that manufacture these digital screens realize that this is a problem. And so that is why you have the blue light filter, which you can set. You don't need to use it in your spectacles. You can set it on the screen itself. And you can do it automatically for the tabs and mobiles. And you need to do it manually for several of the newer laptops and desktop screens. The older laptops and desktop screens, I guess, do not have that facility. And so in that situation, you would probably benefit from using the filter in your glasses itself.
Okay. And so what are the benefits and risks of wearing contact lenses? If one is to wear them, then will they not get dry eyes?
Yeah. So contact lenses are an excellent solution for improved focusing of light for people who are unwilling to wear glasses or where the power of the spectacle is so high that the edge of the spectacles in that high power situation gives a lot of unwanted distortions of light. And so contact lenses would be a great solution in that situation. But contact lenses are sitting on the cornea, on the tears. And so oxygen supply to the cornea is altered. If you are already vulnerable to dry eye, you can tend to have worse symptoms because of the use of contact lenses. If you are in a situation where you are in a humidity controlled situation, like your office is air conditioned or you're on a long flight, then again, the prolonged use of the contact lens is going to worsen the dry eye symptoms. Special caution should be used when using contact lenses. You need to remember that you should not use it while sleeping. Okay.
Okay. So let's move on to dry eye disease. We have a few questions for you. What are the basic symptoms of dry eye and how do you avoid inflammation of your eyes?
So again, let me go back to sharing my screen because some of these things are much easier to show in the form of the pictures and the text that goes with it. So before we go to understanding dry eye, we need to understand what is natural tears and how it is produced. So this is a pictorial of the eye. The lacrimal gland secretes one component of the tears, which is the aqueous. On the white portion of the eye, which is the conjunctiva, the goblet cells produce the second component, which is the mucus. And on the eyelids, there are multiple glands near the which open near the eyelashes, and these are the meibomian glands which secrete the third component, which is the oily portion of the tears. So why is this complex thing required? I'll explain in the next slide. And then the tears flow out through these ducts near the nose into a sac-like cavity inside the back of the nose, and finally drains into the back of the throat through the nasolacrimal duct. So I said we have three components. So if the blue is the cornea, the mucus is acting like a scaffold to stick onto the surface of the cornea. The aqueous is the large bulk, the watery portion, which is in front of the mucus portion. And then the oil is what prevents the aqueous or watery portion of the tears from evaporating off. So if that's the cornea, you have the mucus lining the cornea. The aqueous is the large thick portion, 80% or more, with a thin film of oil to protect it from getting dry. So based on this, there are two types of dry eye. Where the oil is less, you have evaporative dry eye, and where the aqueous is deficient, you have the aqueous deficient dry eye. So what happens during the blink of an eye? The tear film starts to dry, a blink happens, oil is pushed out of the meibomian glands. The aqueous from the surface, from near the lower eyelid, is pulled over the surface of the cornea, and the oily secretions cover and prevent it from drying. So this complex thing happens each time we blink, which is approximately 3 to 4, once every 3 to 4 seconds. So dry eye disease is a multifactorial symptom disease, which got a complex definition. But basically, there are symptoms. There is tear film instability, hyperosmolarity, inflammation and damage with neurosensory or pain in all these situations. So the symptoms we can actually classify using various questionnaires, and one of the most popular questionnaires, which is part of your app as well, is called as the Ocular Surface Disease Index Score, which asks 12 questions, and based on that, you can then divide the eye as normal, mild disease up to 22, moderate disease up to 32, and severe disease anybody with more than a score of more than 33. Normal individuals will be below 12. So this is a very useful questionnaire to understand the symptoms that the patient has. What do we understand by tear film instability? Our normal blink rate is once in 3 to 4 seconds. Normal tear breakup time is more than 10 seconds. And typically what happens is a blink happens before the tear breaks up. So the surface is always wet and moist, no problems. But then blink interval increases when there is increased concentration, as when you're looking on a screen, or if there is an air-conditioned room, or if the oily secretions are of poor quality, in which case the evaporation is much faster, then the tear film breakup happens before the next blink. And this is what is associated with dry eye syndromes or digital eye strain. What does it impact on vision? Anybody who has driven a car in a rainy day will know this. There's loss of contrast, glare, double vision, and scatter of light. And regular wiper working, your eyelids working like a wiper to create a regular tear film, you can see very clearly through that, and that's good quality vision. So there is gross loss of vision quality in individuals with dry eye. Some tests that we have, which can be available in each clinic, is the Shermer's test and the breakup time. but these suffer from not being very specific to identify the problem, and they are not repeatable because depending on who does it and how it is done, the results can be variable. Other devices are available which are very expensive, unfortunately lab on a chips, which measure the osmolarity, and a consequence of irregular tear film is inflammation leading to redness of the eyes of various degrees. And chronic inflammation can be associated with damage to the ocular surface, which can be picked up on using special chemicals on the surface of the eye. And because of the damage, there will be increased pain sensation coming from the eyes, which contributes to the symptoms. And these are all well documented and published data. So one thing that is commonly associated with evaporative dry eye is meibomian gland dysfunction, that on giving pressure on the eyelids, you can see this clearly watery fluid, and this is normal. But often individuals have a thick, slightly milky kind of fluid coming out. And as long as it's fluid, it shows very early disease. And this is much more common. About 1 in 4 people above the age of 50 will have this kind of tear quality. Smaller percentage go on to have much thicker, sticky material, and rarely individuals will have this kind of almost semi-solid toothpaste kind of material. And as a consequence, you can have what is called as concretions on the inside of the eye, or if that thick material blocks the gland, you can have an infection, and this is a stye, what is commonly called as the equivalent of a pimple on your eyelid. And you need to treat it with hot fermentation, antibiotic drops, and painkillers and anti-inflammatory tablets. When a gland is blocked for a very long period of time, what happens is it slowly dies out and stops producing the normal secretions. The meibum is stopped, and there is what is called as loss of gland or gland dropout. And meibography is a technique of measuring the amount of gland dropout that is seen. In terms of treatment options, the conventional and very easy methods to do this is hot fermentation, where you just take a warm towel, you take a little thick, maybe turkey kind of material towel, dip it into warm water, make sure that it's not too boiling hot, and just apply it to the eyelids. This video is courtesy of Moorfields Eye Hospital. And more expensive and fancy methods of doing this is to use various gel containing masks, which can be put in a microwave for a few seconds, and then it gives a similar kind of effect. Lid hygiene is the thick secretions tend to collect on your eyelid and then block the glands, and that material can get infected. You can use lid wipes. One of the common things was to use a baby shampoo earlier, but today we prefer just a moist solution to clear that, and then to use lubricant drop after that. Whenever there is itching of the eye, just remember no eye rubbing. And it is desirable not to splash water into the eyes or any other fluid, because that would alter the protective mechanism of the tears, which includes chemicals to reduce allergies and infections.
Okay. So due to the scarcity of time, we will try to address the questions as fast as we can so that we cover all of the questions. Moving on to the next question. Who should undergo LipiFlow versus IPL? For whom should both IPL and LipiFlow be done? And given that IPL is suggested a few times in a regular pattern, how many times is LipiFlow and when is the most ideal for maximum benefit?
Okay, so the newer treatment modalities are these two, which is LipiFlow, which is thermal pulsations. You can see over here, this individual has got plate kind of thing sitting on the outside. That plate actually compresses the outside portion of the eyelid. And there is a contact lens kind of device which is connected to the inside tube, which protects the cornea and the eye, but which also generates heat to the inner portion of the eyelid, which is where the meibomian glands are. So there is warming from the inside and compression from the outside, and that tends to make the thicker, more solid tear material softer, and gradually push it out and empty the ducts and prevent clogging. So this is LipiFlow is thermal pulsations. Typically, it needs to be used annually, repeated annually. More frequent is probably not of much benefit. It's also fairly expensive. And this is very effective in situations where there is just a mechanical block of the meibomian gland openings. The other methods are IPL or intense pulse light, or IRPL, which is a variation of that, which is shown down here, which is a regulated wavelength of light. Both of them use this intense sliced over the areas adjacent to the eyelids and over the cheek. It's very useful in inflammatory kind of disease, and basically where there is blood vessels which are abnormal and growing around, causing inflammation. These will cause the blood vessels to shrink and clear up. And so IPL and IRPL are more preferred in inflammatory disease rather than in just a mechanical blockage. These also, unfortunately, need to be repeated much more frequently. So typically the repetition would be on maybe a monthly basis, depending on the severity, and typical treatment cycle would consist of around 3 to 4 cycles a month apart.
I see. Thank you very much. We have another question. When and how should you consider probing, and which places are adept in probing in India?
Okay, so probing is a technique where you pass a small 1 millimeter fine needle into the meibomian gland duct. It's a relatively new method of treatment of unclogging the meibomian glands, and I'm not too sure how many people in India are using this process, but abroad there are a few people who have reported good outcomes with that one.
Okay. We have another. Is Triphala eye wash safe for the eyes? Does it help with dry eye?
So Triphala is basically an Ayurvedic preparation of certain plant extracts. It's supposed to be antioxidative, and so you can say that the oxidative stress on the eye could be reduced. But the claims associated with that include for diverse diseases like cataract, glaucoma, and I am not trained in that field of medicine, and I cannot understand the biology of how the eye drop would be useful for dry eye, cataract prevention, as well as glaucoma. So there is a limit to which I know I would look at an Ayurveda practitioner for more knowledge.
Okay. Thank you. So we'll move on to the next question. Have you heard when or if lac research are coming back?
Yeah, so when we have aqueous deficiency dry eye, you are saying that the amount of production of tears itself is very much less. So the approaches in such a situation would be to stimulate the tear production or from the lacrimal gland, supplant it in the form of drops or lacriserts, which are um, longer acting tear substitutes. So the problem with the drop is that once you apply it, few blinks and it is gone from the surface. So you need to increase the frequency. You can use much more thicker viscous materials, but the more thicker the material, the quality of vision through that material is going to be poorer. So it's not something that's very desirable. So Lacazette was manufactured by Bosch and Lomb, and it was something which could remain there while gradually releasing tear supplements. It went out of the market. It was supposed to come back in mid-23. I'm not sure of the exact status and availability worldwide now.
Okay, thank you. We also have a question from a patient asking, will I have to use Sequa lifelong?
Yeah, so Sequa, so cyclosporin is basically for the inflammatory component. And if the dry eye has a component of inflammation, congestion, redness, etc., and the dry eye is either contributing to the inflammation or the inflammation is contributing to the dry eye, cyclosporin and similar chemicals are useful, and they would be need to continue the drops till such time as the inflammatory component is completely subsided and settled down.
Okay. Moving on to the next question. What are the newer treatment modalities to treat inflammatory dry eye?
So inflammatory dry eye, like we said, cyclosporin is one of the treatment options. The previous slide, the intense pulse light therapies also have a role in inflammation. Some of the drugs which secrete, stimulate secretion, ribupamide is, for example, one of the chemicals that come to mind. They all have a role in improving the inflammatory component of dry eye disease.
Okay. So what precautions does one need to take throughout their lifetime if they have been diagnosed with primary Sjogren's syndrome?
So Sjogren's syndrome is autoimmune disease. Basically, it means that your body's defense mechanism has gone haywire. And instead of protecting your eyes, mucous membrane in the mouth, and other parts of the body, it is attacking those areas. And so these individuals with present with dry mouth, dry eyes, and overall secretions will be lower. So obviously, this is a extreme severe form of aqueous deficiency dry eye. Unfortunately, there is no direct treatment for this one. But what we can do is to use secretagogues, supplementation, and whatever little tear is there, we can reduce the way it drains out by putting punctal plugs, blocking the drainage so that there is a greater retention of the tear film and the natural tears as well as the supplements that we use. And this is probably the best method to look at management of, it's basically a supportive treatment.
And speaking of autoimmune conditions, we have another question. Are autoimmune or systemic dry eye conditions always progressive, or can they remain mild or moderate with early management?
So, if autoimmune diseases typically can be progressive, uh, recognizing them early and giving appropriate supportive therapy in these kind of situations would prevent the individual from having severe consequences of the disease. And so early detection and treatment and the questionnaires that are suggested today actually look at triaging question. You look for allergies, you look for individuals with a dry mouth as well, to identify people with these kind of other systemic problems not related to a primary dry eye syndrome, and identifying them and giving them appropriate therapy would prevent them from having severe consequences of those diseases.
We have another question related to diets. Are there any food items that can help get rid of dry eyes? Loss of which I think what deficiency causes dry eyes majorly, and can this be restored by consuming some kind of food?
Yeah, so I briefly mentioned that omega-3 fatty acids, it was one of the very popular things. Right now, there is a little bit of a question mark on it, and I'll explain why. So what they found was that 2011 or so, they did a study where they found that in one population group, which was consuming a lot of fish and fish oil, the incidence of dry eye was very, very low. And they concluded that it could be from the omega-3 fatty acids, which came from the fish oils. And so then omega-3 fatty acids became a good supplement. And it is even now available in the market as a supplement or for prevention or treatment of dry eye. Now, more recently, a study had come out which looked at omega-3 fatty acids for one group of people and olive oil for the other group. What they found was that the difference between the two groups was very less. So people who consumed olive oil also seemed to have some improvement in their quality of tear film, and the omega-3 fatty acid group also seemed to have some difference. So the difference between the two groups was not very significant. So that's why recently there is a question mark on this one. But I guess there is no harm in using it. And it is certainly shown to show some improvement in a subgroup of people at least.
Okay. We have a question in chat. Is LipiFlow available in Mumbai? And how is LipiFlow different from warm compresses with massages?
Yeah, so if I can go back to the, so LipiFlow is just heat and lid massage. Whereas the other one, there is moist heat, but not so much of a massage. Okay, so essentially there is heat is common to both. The massage is present in LipiFlow, not so much in the other situation. There is no moist heat in this one. So subtle differences are there. And LipiFlow certainly is available in Mumbai. I'm not aware of individual doctors or clinics that are using it, but I'm sure it is available there.
Okay. So we now move on to some questions that we got from patients that are more detailed and more about their own personal condition. We'll start with the one in chat first. I have been diagnosed with an MGD and I'm doing better than before these days. My eyelids don't feel pain. My eyelids don't pain, but I don't feel pain. But I do feel pain around maybe the lacrimal ducts these days. when I'm looking in the wind or when I look at the screen. I remember this is how my dry eye started. What shall I do?
Yeah. So pain, itching just near the eyelids, either corner of the eyelids is one of the most common symptoms of dry eye. So what you could consider is if you're using lubricants to gradually increase the frequency of lubricants, if it is happening like is mentioned in looking into the window, etc., maybe just a pair of protective goggles to reduce the amount of wind onto the eye surface. These would be simple methods to uh, make the situation more comfortable and reduce the irritation and discomfort associated with it. Warm compresses in all these situations would also most likely benefit the individual.
Okay, thank you very much. Moving on to the next question. My problem is that my upper eyelids, especially the left one, feel heavy and irritated. It's like there's some sensation there, sometimes light and sometimes more noticeable. I also feel a sort of bubble inside my eyelids. Eye dryness is negligible, but due to this eyelid problem, I feel uncomfortable. However, my doctors say there is no dryness and no issue, and I should continue using lubricant and gentle gel. So my question is, what is wrong with my eyelids?
Uh, so this if the individual is having some benefit from using lubricants, gentle gel at night, so there seems to be an underlying dry eye condition there. Okay, so it is possible, and this is one of the most fundamental problems associated with dry eye, where the individual will have symptoms, okay, and the measurable signs associated with that disease process may not be there. This is what we call as a subclinical or preclinical disease condition. And so my suggestion on days when you feel uncomfortable, it may be associated with air conditioning, excess use of digital screen on a particular day, or watching a movie for a long period of time on a particular day. World Cup cricket is going on, so this is one of the times when you're going to be sitting and staring at the screen for a long period of time. So these are all situations which could exacerbate very subtle underlying condition. So on those particular days, increase the frequency of the drops, to do some moist compresses, use the gel at night, and you don't need to have a fixed routine of 3 drops a day or 2 drops a day. Adjust it according to the symptoms you feel on that particular day.
Thank you very much. Moving on to the next question. Basically, when I read about the causes of dry eyes, I seem to fit into every category. I've had LASIK, used Accutane, and had a vitamin D deficiency, but I'm not really sure what actually caused it. So far, cyclosporin, steroid ointments like Occupol DX, lid cleanser, and Manuka honey seems to help me a little, but not up to the mark. What else can I add to my regimen that will reduce my symptoms?
So LASIK in vulnerable individuals is a risk factor to worsen or initiate dry eye. The use of isotretinoin, which is the Accutane to treat acne, is again potentially associated with dry eye. Vitamin D deficiency also can be associated with dry eye. So all these are risk factors, but you need to maybe approach a ophthalmologist and figure out what is the root cause, whether it is a aqueous deficiency, whether it is evaporative, or whether it is a combination of the two. And once you have that, then you can have a little more focused treatment. You are using like you said, cyclosporin and steroid ointments, you need to probably consider in case there is a greater amount of inflammation, you can look at rebapamide and other anti-inflammatory IPL treatment would be maybe beneficial in that situation. Whereas if it is a meibomian duct blockage, then consider things like LipiFlow or maybe probing or something which would unclog the ducts and improve the lipid flow, the flow of lipid from the meibomian gland ducts.
Okay, thank you very much. Moving on. My symptoms have worsened after using artificial tears equipped with benzalkonium chloride preservative. Due to this, my eyes have started sticking, especially in the morning. I think my mucin or lipid layer has been disturbed. Is there any way to reverse the side effects of PAK or increase the mucin layer?
Yeah, preservatives are required for almost all eye drops for the simple reason that it is a multi-dose vial. Okay, so if it is a multi-dose vial, after you open it, if you want to make sure that the remaining contents are sterile, do not cause infection, you want to have a reasonable shelf life of at least a month or something like that, then preservative has to be there. So benzalkonium chloride was one of the first and is still most commonly used preservatives. But in a small percentage of individuals, it causes dry eye kind of situations. Another role for benzalkonium chloride is that it disrupts the junctions between the cells of the epithelium, which allows the drug to penetrate into the eye. So two roles are there for benzalkonium chloride. If those two roles are not required, then we can look at other options. Okay, so I can readily think of three other options. First would be to use lubricant which is preservative free, which means it would be a single dose vial. UNIMS it is called, and they are very expensive because it is a single use. You few equivalent of 1 or 2 drops will be there in each thing. You break it open, apply, and discard it. As a consequence, it is more expensive, so it's not become very popular in India. The second thing would be to go for drops like which was shown in the Mofield's video, where the dropper, the bottle technology itself is different so that it prevents contamination. And those are called as ABAC bottles. Again, the bottle itself is more expensive, though the chemical or the constituent inside may be the same. And that is the second option. The third option that is available to individuals like this is to look at the possibility of using different types of preservatives which do not have these harmful effects. So there are preservatives like purite, sodium perborate, which once you apply it into the eye, it basically breaks up into salt and water. And so they almost instantaneously and so do not have any harmful effects on the mucin or the ocular surface. Now, coming to the second part of that question was what can be used to increase mucin layer. Like I said, ribapamide is one of the molecules which is available to improve the mucin layer. It's also got anti-inflammatory properties. The other one is a chemical called diacosol, which again has a role in improving the tear quality. And these are the two things which can improve the mucin production from the goblet cells on the conjunctival surface.
Thank you very much. I think we may have missed a question in chat, so we'll go back to that. Does the blink rate really affect dry eye?
Yes, certainly. So there are various studies which show that, Our typical blink rate is approximately 15 to 20 times in a minute. So that means every 2 to 3 seconds, there is a blink happening. So the tear breakup in a healthy normal individual is supposed to happen at 10 seconds. So typically much before the tear breaks up, the next blink has happened and it is getting refreshed prior to the next tear breakup happening. But when you are concentrating, pilots landing a plane, not in today's situation, but when they were today, most of these things are automated and computerized, so you don't have maybe that much of strain. Surgeons when operating, drivers on the road, when they're individuals like accountants, when they're looking at a screen, all of these things, when there is a higher level of concentration, eyelid opens wider in order to not miss out any information that is happening, as well as there is a tendency for the blinks to be much less. So the blink rate can reduce to even once in 10 to 15 seconds. That will be 3 to 4 blinks in a minute. And blink tear breakup time being about 10 seconds. If the blink rate is 4 times in a minute, then there is 4 to 5 seconds of irregular or dry ocular surface before the next blink.
And adding to that, that is also the reason why we developed ID, with the intention of making sure that people cultivate healthy thinking habits. Since we have, so let's try to squeeze in one more question before the time is up. Can stem cell injections be used to try to regrow the meibomian glands? Stem cell injections derived from adipose tissue. What are your opinions?
So this is the hot topic. Regenerative medicine is a hot topic. Okay, and lot of work has been done. They have been able to identify what it is that causes the meibomian glands to function poorly. A good amount of understanding is there on what genes expression is blocked, which causes evaporative dry eye disease to happen. There is also some amount of work which has happened essentially on mouse models, I think, to look at trying to reverse this process, and much more work needs to be done. But I'm sure it will not be very long before there is some commercial product available in the future.
Thank you very much. I think we are pretty much done on time. So I would like to take this opportunity to thank you very much for answering all of these questions. Thank you for your valuable insights and expert guidance during this session. Your answers have made our event so much more beneficial, and I'm sure that everyone watching has benefited from your advice as well. I'd also like to thank everyone present here and for submitting all of your questions. Those questions will help guide not just the people here, but everyone in the community as well. I would just like to remind people that we've developed ID as a preventive care tool, and it is made with the intention to help you practice safe screen time and protect your eyes and make sure that you're blinking healthier, because healthy blinking habits really do tend to go a long way. And if you have any feedback regarding the app or any feedback about this session, please feel free to reach out to us at info@autouse.com. And if any of the questions went unanswered, we'll make sure that we mail you the answers or get back to you either way. Thank you again to everyone present here. Have a great night.
Thank you very much.